Hi, I'm Yuval. I'm a registered social worker and psychotherapist. Today, we'll be talking about psychiatric hospitals and what you need to know if you're going to stay there or if you're bringing a loved one to a hospital. Let's start with when hospitalization is necessary. Keep in mind that for the duration of this video, I will be coming at it from the Ontarian context, specifically in Toronto. In Ontario, we have something called Form 1. This is used when somebody tells a psychiatrist that they have plans on committing suicide or homicide or harming themselves or another person in any significant way. And we usually see this when people are suicidal. So, when that is the case, it is in the person's best interest to be hospitalized. Now, the Form 1 only lasts for 72 hours. Afterwards, what we usually see, especially for the first visit to the hospital, is that they could strongly benefit from a voluntary stay. What this stay is useful for is to get more information about a new diagnosis they may have received. It could be useful for maintaining stability in the long term. It may be useful for the person to have a place outside of day to day life where they can process what just happened to them before the hospitalization and with the new information that they've received. I'll explain a little bit more about the benefits very soon. The other reason why somebody may end up in a psychiatric hospital is because of Form 2. And this can only be filled out by the justice of the peace. So somebody was acting violently. It is very obvious to everyone that they are experiencing some kind of psychiatric episode. And so they are taken to a mental hospital rather than the justice system. Usually, these guys have their own ward and they are separated from people who come into the hospital through Form 1. So, Form 1 can only be issued by a mental health professional, while Form 2 is something we would see being filled out by police or judge, for example. So, people often ask which hospital to go to if their loved one is having a psychiatric emergency. I can only tell you from a Toronto perspective, and that is CAMH. I refuse to go to any other hospital with my clients except for CAMH. They are the gold standard. They have the best aftercare, the best inpatient staff, and also that's the hospital I was fortunate enough to go to when I needed it. It has changed a lot, but in terms of the Toronto options, Cam H is the best. Avoid St. Michael's as best as you can. I will leave it at that. Many of my clients are bipolar or have someone in their family who is bipolar. So I want to touch upon how hospitalization fits into the manic depressive cycle. People who are in mania don't tend to go to the hospital because they don't think anything is wrong with them. When we do see people in mania in a psychiatric hospital, it usually is because they got Form 2'd, meaning that they broke the law in some way. The police came to them, and with their discretion, they decided to take them to a psychiatric ward rather than the police station. Something that's a little less common is the manic person will be convinced by the people around them to go to the hospital, usually they will walk out mid-process before they became official inpatients. But sometimes they do become inpatients at a hospital. However, they are very unlikely to stay there for the necessary period of time because they need constant stimulation at that state. And the psychiatric ward is anything but stimulating. It's quite boring. And so they will usually leave. And this is because they weren't formed one, because they were not a danger to themselves or others. They are there voluntarily, which means that they can leave at any time. All they need to do is sign a contract saying that they understand that they are leaving against medical advice. That way, if they do something outside of the hospital cannot be found responsible. I want to get some of the misconceptions out of the way about psychiatric hospitals. So, here is a small list of things people believe about it. So, some people believe that psychiatric hospitals are only for severe cases. I would say yes, severe cases can be found in psychiatric hospitals, but most people there, I would say, are struggling with depression or really bad circumstances. Sometimes you lose many people in 1 week, you lose your job, you lose your housing, things go wrong, and we're human and we're all prone to breakdowns at some point. So you can have people in a psychiatric hospital who don't have a mental illness, they're just really down on their luck. Another misconception is that patients or inpatients are held indefinitely. That can't be further from the truth. The hospital wants you out as quickly as they can get you out responsibly. The reason for this is, like all businesses, they work on metrics. How many people did they help that year? If they're holding you indefinitely, you are getting in the way of them showing their investors and showing the government the potential amount of people that they could help. This is actually a carryover misconception that came from the asylums, which back then, yeah, some people were held indefinitely. But a psychiatric unit in a hospital is very different than the asylum. So please don't confuse the two. Another misconception is that treatment is just medication. You don't need anything else, and the hospital doesn't offer you anything else. I wish medicine alone could treat all mental illnesses, but that's not the case. If the person isn't paired up with a psychotherapist that they can talk to about their feelings about taking medications, about the hospital, about all that they've gone through regarding mental illness, the chances of them taking the medications are very slim. And I think bipolar disorder perfectly demonstrates this because you have this manic state that, although everybody around you hates it, you love it with a passion. There are people who are willing to sacrifice everything so that they could have their annual manic high. If you just gave them medications and you didn't talk to them about the existential threat that it poses to their idea of what life is, they're not going to take it. So, medication is not enough. Also, we need to be on guard for symptoms. So, if we didn't have a psychotherapist or a psychiatrist who is familiar with the symptoms of the medications as well as the illness, the medication will simply not work because the chances of it never needing adjustments are next to none. So it's medication plus talk therapy in various forms that fit the mental illness. Another misconception is that it is going to ruin your future. I don't know what it's like in other countries, but in Canada, we have the right to medical privacy, meaning that your employer will not be able to see that you were in a psychiatric hospital unless you tell them. And by the way, that goes for everyone in your life. If you don't want to tell people that you spent some time in a psychiatric hospital, that's well within your rights. And in Canada, they don't have the right to know. So that's on the privacy front. Now, I'm just going to give my own example so that you tell me if hospitalization ruined my life. I wasn't able to keep any job for longer than a few months because I was a mentally ill drug addict. Every summer, I would have a manic episode and I would quit any job I had to pursue some psychotic narrative that at the time was the most important thing. I would show up to work on drugs, openly carrying a flask. I was simply a mess. Once I was hospitalized, I was properly diagnosed, I was properly medicated, I was given the appropriate therapies to allow me to never have another episode again and to get sober. And I've had jobs for far longer than I was ever able to have before hospitalization. So I disagree. I don't think that going to a psychiatric hospital will ruin your future. Another misconception is that psychiatric wards make mental health worse. So I'll agree and disagree on this one. Short term, yes, you do not feel good when you're in a psychiatric ward. I don't know anyone whose mood is lifted by being there unless that lift is due to part of the mental illness or something that they gave them. It sucks being in a psychiatric hospital. It just does. However, in the long term, it's the best thing. It's like saying that surgery makes your health worse because at the time of surgery, if you just look at that snapshot, you are opened up and you're prone to infection. So surgery makes you worse. Yeah, but only if you look at that snapshot. If you look at the long run, it makes you a lot better. Let me explain some of the benefits to hospitalization because it's not a pleasant experience, but it's worth it. Usually, people start their recovery in the hospital because you are now away from your day to day life and you can say, that isn't working. I can't keep going on like this. I need to change course. And because a hospital removes you from your average environment, you can start to have that conversation because you don't have to keep going while depressed or psychotic or something else. Additionally, the inpatient psychiatrists are the best psychiatrists you're going to find in the public sector. They are the ones who deal with the most severe cases. And because of that, they have a much more nuanced take. I was wrongfully diagnosed 2 times in my life, and I was only correctly diagnosed in CAMH. Additionally, the inpatient psychiatrists have more time with you than you would usually get with outpatient psychiatrists who may see you an hour every week or so. In the hospital, the psychiatrist needs to figure out what the appropriate diagnosis is so that they can start with treatment right away. With outpatient psychiatrists, that sense of urgency usually isn't there unless there is an emergency. Additionally, you can receive a lot of education and resources when you're in the hospital because they have a discharge plan. And usually that plan involves some kind of psychoeducation about your particular mental illness or some resource like a support group. I know when I got my discharge plan, I used up all the resources I could. I went to all of these support meetings for people with bipolar disorder, for people with addictions, AA meetings. I went to it all because I really needed to change my life. So, the good thing about hospitalization is you're not left by yourself when the stay is over. You're usually shown a path or multiple paths of what you can do to continue your recovery. And I promise you, the more you go down this recovery path, the better life gets. It's not going to be as you are experiencing it right now if you're the person suffering with mental illness. No, it gets better. Another benefit to hospitalization is that you receive outpatient psychiatry. Now, this can depend if this was your first visit at the hospital or not. And also because of staffing challenges, things do change. When I was hospitalized, I had an outpatient psychiatrist for 3 years afterwards, and she specialized in bipolar. She was incredible. Shout out to you, Dr. Leon. Um, but I'm hearing stories that is no longer the case in some circumstances. Some people are getting as little as 3 months. And a lot of the psychiatric role has been pushed on to general practitioners. But that's another story. The last thing that you can benefit from being hospitalized is that the diagnosis could help you obtain Ontario Disability Support Program, the ODSP. Many people think that you can't work if you're on ODSP. This is not true. You can work. It's just that the amount that they will give you will be less. However, you will still be making more money. So I highly recommend ODSP to all of my Ontarian clients because it's a support system that doesn't cost you anything and that only provides you money. And it has a bunch of other benefits too. So if you're not working or if you are working, I highly recommend this program, which can only be accessed through a diagnosis. Now let's talk about what to expect when you visit the emergency room at a psychiatric ward. So the first thing is intake. You'll talk to someone at the counter. They'll ask, who are you? Who is your loved one? Why are you here? And you'll give them your ID. They may ask your relationship to the person that you're bringing. And then you have a seat. And some time goes by, and you'll enter a room to be assessed. And this is called triage. So they will ask the person who is suffering more about what is going on. They'll also take some vital signs to rule out a physical cause to what's going on. And after a conversation, which doesn't take too long, I would say 30 minutes maximum. It's usually closer to 15. They will either give you a Form 1, give you an option to enter voluntarily, or refer you to somewhere else. If you're going to be an inpatient, whether through Form 1 or voluntarily, you will enter another waiting room, which is called the Emergency Department Observation Unit. And Unfortunately, you have to go to this unit alone. So you have to say goodbye to whoever has brought you there. But don't worry, you can see them during your stay. And in that observation unit, you're just waiting for a bed to open up. And the waiting can be anywhere from no waiting and you get a bed, or you'll have to wait a few hours. So that's why I recommend bringing a book, something light, or Sudoku, crosswords, or whatever you are into, something just to pass the time, because it can take a while and the vibe isn't that good. So, what to bring? For sure, your health card, ID, a hoodie, sweatpants, socks, underwear, because you want to be very comfortable, because you could be there for a few days. And the good thing is you have no one to impress with your awesome fashion style while you're in the hospital. So you can have the laziest clothing. And the good thing about hoodie is it can also keep you warm. Sometimes it's a little cold in the wards, so it's better to have it than not. Also, bring earplugs. Many psychiatric wards have the intercom speaker within every room. So if there's a code white, a code blue, regardless of the time of day, you will hear it if you're in your room very loudly. So bring earplugs. Also bring a sleeping mask, because security needs to do rounds quite frequently. So they may go by your door and shine a flashlight to see that you're sleeping. It sucks, but there's been reasons for this to happen. So best to bring a sleeping mask to sleep well. Bring a book, like we said, and your phone and charger. Now, you may not be able to have those in the first few hours. The reason is that they want to process everything you have to make sure that they have everything that you brought in when you are leaving the hospital. So everything you bring in will have a little sticker to show that it has been processed by the ward, and to keep track of whose thing is whose. You can also leave things with the ward admin if you are worried about things getting lost or stolen, which honestly isn't as much of an issue as you may expect. Also, the charger, you may get that a bit later because it is a string, and the stereotype that you can't have your shoelaces in a psychiatric ward are true. And a charger could be used for the same purposes. So, because of that, they need to make sure that you're not actively suicidal before bringing you the charger. If you are the person bringing your loved one to the ER, here are some of the things you may want to ask. You may want to ask about the visiting hours and how many visitors are allowed at a time. I know different hospitals and different wards have different protocols for this, so it's best for you to know which protocol applies to the specific ward that your loved one is going into. You may also want the number for the ward that your loved one is going into, because that is how you will schedule the visits. You can't just show up, you need to make an appointment. And you also may want to ask about resources for yourself, your family, and your loved one in the future. It can be incredibly stressful to have a loved one go into a psychiatric hospital. It's this weird state because you have to go back into daily life knowing that your loved one is somewhere where they don't want to be and are really struggling. So find out if they have any resources to help you, because it's not easy for your loved one and it's not easy for you. And if something can make this whole situation a little bit better, why not? So, what to expect once you are an inpatient? Like we said earlier, in the hospital, you can get diagnosed much more accurately because they have more time with you, and you will see them a few times during your stay, as well as a inpatient psychotherapist. Now, the frequency of these meetings could drastically change. It is no secret that we have a shortage of nurses and psychiatrists. Because of this, I've heard some stories of people only seeing the psychiatrist once during their 2 week plus visit. The same with the inpatient psychotherapist. Hopefully, you'll get to see them more. The best practitioners are the ones in inpatient. After your diagnosis, they will give you some options about which medications to take. I remember when I had it, they gave me like a 2-3 page PDF for every possible option, and they'll also tell you which one they think would work best for you. Depending on the medication that you take, they may need to monitor your blood levels. This doesn't need to concern you too much right now, but it's actually a giant benefit of being in the hospital because when you're first starting on lithium or some anticonvulsants, they need to take your blood quite often to make sure that the medication is within the therapeutic dose, because too little will do nothing and too much can cause side effects. So it's important for them to monitor it. And yeah, you will get your vitals tested quite a bit. There's also group activities. These are hit or miss, but I do recommend you go to them because what else are you going to do? It's a very boring place to be in. You'll get 3 very bad meals a day, and you also have the option of going for a walk once a day with staff supervision. You would really want this once you're inside because there is no open windows, there's no fresh air. So if you could go on the walk, do it. There are some circumstances where people don't get that option, usually if they're formed, and especially with Form 2. They want to make sure that you're not going to run away. So now let's talk about how you, as the parent, the sibling, the loved one of the person who is suffering, can help them when they are in the hospital. So the first thing is to call their employer or school and inform them that your loved one is not going to be able to attend because they are in the hospital. The great thing is you don't need to say what kind of hospital. And employers, I found, are much more tolerant of absences with hospitals than if you said they're not feeling well. So the purpose of doing that is you will ensure that they have some kind of stability and routine to go back to once they are out. And of course, it is ideal that they take some time between hospital and work to really process what's going on. And there's no shame in that. I think it's actually better because if you don't process everything, then you're more likely to relapse. Personally, I took 6 months from getting out of the hospital to going to school. I needed at that time to learn about the disorder, figure out what it means for my future. And I'm so glad I did because I got sober, I got stable, and the future's a lot easier than if I didn't take those 6 months. Another thing you can do is bring them food, and they will absolutely love you for this because the food in the hospital is horrible. Just the food alone will make you depressed. So if you could bring them food, that's fantastic. And now they have Uber Eats option. So they will tell you what to put within the instructions of the Uber Eats app. And yeah, you can get Uber Eats at a mental hospital. Likewise, you can also leave food to be picked up by the ward administration if you are not able to make it for a visit. Another thing you can do, which I'm sure you want to do, is to see them during visiting hours. They will greatly appreciate it. It can feel very lonely in a psychiatric ward. You're quite uncomfortable, and a familiar face will bring a lot of comfort. Also, you can bring more visitors if your loved one is okay with it. I know I never felt bad for having more visitors while I was there. I was so grateful for everyone who saw me throughout those 2+ weeks. And your loved one, I think, will remember it too. And the last thing that you can do to help your loved one is to bring in an external psychotherapist that they can see long after the experience. So much of the therapeutic process is the therapeutic relationship between the practitioner and their client. The practitioners that your loved one will receive are time limited, and we don't exactly know how long your loved one could see them until they are already at the hospital. So, having someone who can see them for the long run, because recovery is a very long game, that would be ideal. And this is a lot of the work that I do. I'm a social worker and psychotherapist that is also a peer support worker, meaning I have been trained in the various modalities that could help people with various mental illnesses, but I was also that mentally ill guy. So I'm a peer support worker as well. I used to do dual recovery meetings for people who had severe mental illness as well as addictions. I get how it is to be a psychiatric inpatient. So a lot of my work is to go in during visiting hours to meet with my clients' loved ones, have a conversation, bring them someone who gets it, who has been there, and can now be a source of inspiration for them. I bring a lot of hope because if they're anything like me, they could have never imagined of having the life I have. And, it's not this grand story, but it's satisfaction with stability that for many bipolar people is horrifying. So if you think this is something that your loved one could benefit from, feel free to reach out. I offer a free 20-minute consultation. I will link it in the description. I really hope this has been helpful, and it's not an easy thing to go to the hospital with your loved one or as the person suffering. And I wish you all the best. Bye for now.